Good morning, everyone, and thank you all for joining us today. I'm Dave Mathews. I'm a partner here at Seacrest Pritchard and your host for today's webinar. If you're not familiar with us, Seacrest Pritchard is a large, privately held insurance broker with over 300 associates based in Savannah, Tampa, Little Rock, Birmingham, and our home office here in Atlanta. We provide property and casualty, employee benefits, as well as risk management services to businesses and individuals throughout the United States. Several of my clients and clients of the firm serve youth. We insure schools, camps, social service organizations, daycare centers, churches, medical facilities, and many other businesses. For that reason, we wanted to provide some content that focused on children this fall. You may have attended our sexual abuse prevention webinar last month. If you missed it, email us and we can send you a link to the video and other resources. One of the leading conversations about children over the last few years has been the status of mental health. Media sources are raising the alarm. My clients are discussing it as a growing risk, and you or someone you know may be impacted by mental health. Today, we want to focus on mental health with a specific emphasis on youth. For our conversation, we're partnering with an organization with a long history of providing mental health services for kids in crisis. Hillside was founded in 1888. It is a large, nonprofit organization offering a continuum of services for children and adolescents struggling with emotional and behavioral issues. Hillside is based here in Atlanta near Midtown. Joining me today are three experienced providers of child mental health services at Hillside. They are Gaan Akers, Amy Rene, and Kimberly Young. I'm going to let them introduce themselves now. Gaan, first to you.
Hi, my name is Gaan Akers, and I'm the Clinical Education and Referral Relations Manager at Hillside. I work with providers and families to help their kids get the services that they need.
Amy?
Hello, my name is Amy Rene. I'm the Vice President of Clinical Programs at Hillside. I've been here for 18 years and my responsibilities span leading and being a member of the executive team for all of our services. We have residential programming, day programming, and also intensive outpatient services. So we'll be talking about some of those today. Thank you for having us.
And Kimberly.
Hi, thank you guys for joining us today. My name is Kimberly Young. I am a psychiatric nurse practitioner and the assistant medical director here at Hillside. I help to oversee many of the residential operations for our residential campus and ensuring that our clinical services are as high quality as they can be. I am an intense advocate for child and mental health, child and adolescent mental health, and ensuring that they get the services that they need at our level of care and throughout.
Great, thank you all. So we have several questions prepared for each of our Hillside hosts today. Some of them we've developed together and others came in from our attendees, from you as you registered and RSVP'd for this event. So we hope to get to all of them today. We're going to start with some questions for Gaan, and we're going to start with a big picture question. So what are some national trends you're seeing today in mental health?
Yeah, so if we talk about national trends, especially with youth mental health, we've seen that there's been an increase in need for services. Since about 2009, we're seeing from like the Surgeon General's report that there's just been an increase in symptoms of depression and anxiety. The suicide rate has gone up substantially for young people. And during the pandemic, we saw that this is like data from about 2020, 2021. We saw that the suicide attempts had gone up almost 50% for adolescent girls and a little bit for boys, but mostly adolescent girls. And so we're seeing a huge increase in need for mental health services and mental health support. Kids are not doing okay with their stress and the pandemic just kind of exacerbate a lot of that. So that's kind of where we're sitting right now in terms of national trend.
That's great. Thank you. So let's bring it down a little bit closer to home. Is it any different in Georgia? What is the status of mental health here in Georgia?
Yeah, so in Georgia, I think we pretty much reflect what the national trend was, when we looked at the emergency room admission data. We saw that same kind of increase with teenage girls really struggling with thoughts of suicide or attempts. The good news is, like, I think in 2021 or 21, even though the attempt or the thoughts or the reasons that kids go to the emergency room was behavioral health, the actual completed suicide rate actually went down. And of course, there's a lot of, we can guess at a lot of things, even though kids are in distress, right? They're not able to complete their plan. Part of it is because they're at home all day with their parents. So there's increased supervision, there's lack of freedom, so they couldn't just go and kind of acquire their own means of self-harm. And so even though the good news is we saw less completed suicide, we still saw a huge increase in the need for support, because apparently, kids are just in so much more distress. In terms of what's exciting in Georgia specifically is that in the last year, we have passed the Georgia mental health parity law. And that is a big step for Georgians and families to be able to access mental health treatment in the same way that they've been able to access physical health treatment that's covered by their insurance. The parity law really guarantees that insurance companies, whether it's the private insurance company or public insurance like Medicaid's, have to cover their mental health treatment in the same way that they're covering physical health treatment. So it's a huge step. And it also means that we're still in the process of figuring this out. Part of this law gives a little extra funding so that there's more oversight. It's making it easier for families and consumers to report when they feel like their insurance is not treating them fairly because they're having a mental health need instead of a physical health need for treatment. But there's several things kind of in the works that would hopefully increase more access for consumers.
Thank you, Gaan. That's great. And let's stick on that topic of suicide for another question or two, because that's obviously the tragic outcome of the mental health issues that we have. Kimberly, we're going to move on to you. So what are some factors that you've seen that have contributed to the increase in suicide attempts here in Georgia?
Well, difficult question. It's very complex, and Gaan has already hit on a lot of those factors. I think that the pandemic had a significant effect on the isolation of children and adolescents, especially the females, like we saw. Nationally, the social media usage and the increase of social media with this age group has been very impactful on sharing of information, getting ideas. Sometimes the kids are looking for connection, and really social media isn't connection. As we know as adults, it's really more communicating, but it's not connection. And so they're looking for connection through social media, and then what happens is things start to get copycat type of effects, and almost staying within their emotions rather than being more proactive and moving forward as you would in therapy or talking to their parents about what's going on. So that's a big, huge factor as well. And in Georgia specifically, sadly, our mental health system here in Georgia is in need of a lot of restructuring and a lot of enhancement. And we are all very, very excited, as Gaan mentioned, with the passage of the Mental Health Parity Act and the things on the horizon. I do think that we have to look at how did we get to this point. And, if you look at 150 out of 159 counties in Georgia, are considered mental health professional shortage areas. That is drastic. And so we've got this cluster here in the Atlanta metro area where the majority of mental health professionals are. And we as a state have got to figure out, and the Behavioral Health Commission reform, or Behavioral Health Reform Commission and the Parity Act are all helping to do these things. So there is a lot of hope. And so I don't mean, I'm not painting, that things are awful, because we've had such great change coming. But we've got to figure out a way of how can we meet these families that are in the other parts of Georgia. Like this metro Atlanta area is not the only part of Georgia. And so as mental health professionals, as an organization, we are working really hard. How can we reach out to those families? Because we've got to figure out how to get the health care there, mental health care there, and be proactive. So it may involve more involvement with the primary care physicians, having behavioral health in there with primary care, more involvement in the schools with more counselors in the schools, so that we are catching quickly when children are struggling, so that we can make an impact early before they get to the point of feeling suicidal ideation or making an attempt and a family never even.
That's great information. Thank you. So, on that thought of the pandemic and isolation being a catalyst for mental health issues, what are some warning signs that someone might be struggling with their mental health? And have you seen a difference between warning signs for children versus adults?
Absolutely. So let me start with, I think our society knows about the typical, what do we think of when it comes to someone maybe suicidal? The standard things that you would see when you Google suicidal ideations are going to be things such as drastic change in mood, drastic change in presentation. You may also see like giving away certain items or leaving notes, making comments that they don't want to live anymore. Although those are still very prominent and we want to monitor for those, it's really honestly the small little nuanced changes that we see that show that someone their mental health is changing. And that's when we want to catch it quickly. And with children, we actually see even different. So children, parents can miss it sometimes, miss it a lot of times because of what changes. And it's hard because children and adolescents, especially that preteen, early teen age, the irritability, the kind of arguments that we expect of normal teenagers are easily dismissed by family and society. So it's not like fault of anyone. It is absolutely what we think, oh, there's that teenager again. Well, I really, really encourage families and parents to really look deeply at what they're seeing from their child and try to track back, when did I start seeing this change? And what exactly are we seeing that's different? Because it's any type of change that's going to mean something is going on with your child. Monitor the social media. I highly encourage to monitor social media. And it's just as long as you are keeping a high level of communication with your child and understanding with, kind of what they're going through, knowing what's going on in their life. Are they experiencing peer conflict at school? Is there bullying? You as a parent will be able to catch on those little small nuances I mentioned quicker, that are going to then indicate things are changing.
Thank you, Kimberly. I'm going to stick with you for a second because we've talked about social media and monitoring it, and I know that's a huge issue. Have you found or run across a tool or a good way to advise parents on how to monitor social media? Or is it literally just when the kid goes to bed, don't let them take their technology with them and look and see what they've been looking at? What would you recommend?
I see us all kind of laughing a little bit here from Hillside because that is a complicated question. And especially if you're going to make a change, right? So let's say you have a child who's 14 and they've been used to taking their phone to their bed every night, and now you say, well, you're not going to have it anymore. We have to take baby steps. But the tools, there's several different tools out there, and we certainly can share those with you guys, and then you can share with your group. I think there's probably 2 or 3 different apps. And Amy and Gaan, if y'all know, jump in. I know one is, I think, the Bark app, right?
Yes. Yep.
Yeah, Bark app that can monitor. And I have to say, these kids are smart in this day and age. They know how to get around every corner possible. So I think what you mentioned, Dave, of setting limits of the usage of the phone and when it's used and where it's used is, in addition to these monitoring apps, is the most effective way to ensure that your child is maintaining safe boundaries on social media. So don't take it to your room. Don't have it at the dinner table. Only a certain amount of time at night, and use in front of, with the family, out in the family room, those type of situations. Maybe only get your child a flip phone. I'm a strong advocate for they need phones to be able to reach out for help and to communicate. But do we really need to be on the internet and flipping on our apps all the time? No. And children and adolescents really need to be practicing communication. And so the least amount of technology that they have, I think, better. And I don't want to limit them from growing, because our society is going in the way of technology already is. So it's a fine balance.
So thank you for that. I have heard of Bark before. I need to explore that a little bit more, especially with my 2 boys who are 11 and 13 and spend more time than they should on YouTube. Thankfully, when I look over their shoulder, it's mountain biking. So I hope to keep it that way. All right. So Amy, we're going to move to you. So considering the many barriers to getting adequate mental health care, what can parents do for children that a child that is having a mental health crisis?
So when you say mental health crisis, I'm going to say the first thing is call 911. Crisis in the mental health space, it ranges, right? And so 911 has to be used if you have a life-threatening situation where your child has overdosed, where your child is has at risk of cutting themselves or doing something that's extremely drastic. Luckily, Kimberly talked about some things that I'll pull out when I'm working with parents, that if you start to see changes in your child, get help immediately. And the first place to go is your healthcare provider. So I also have an 11-year-old, Dave, that's about to turn 12, and she was screened at her physical this year for mental health issues. And I was super excited to see that as a clinical social worker, that they actually ask her questions about depression and anxiety. That is the place to pick it up so that you can prevent the crisis. And so if you have that conversation with your pediatrician and get early intervention and screening, hopefully you will never need to access crisis services. Accessing crisis services in our state and in our country is not kind and nice sometimes. And so there's still a lot of stigma. And I'm so happy that you guys invited us to come talk. We all 3 were like, yes, because we all believe that as we can break down the stigma of mental health and talk about how many people are struggling with this, that we will build community and build connection and not have crisis. So if you get services early on, you will make a difference with your child, and you won't have to be hearing about what to do when there is a mental health crisis. I will mention there's a national phone number now that's 988. And in Georgia, it does link you to My GCAL, which is a service that's a state funded service. And so is a great way to access suicide and crisis. So if you don't need 911 because you're not having a life-threatening situation, 988 is a great resource. There is also the My GCAL app. Application on your phone. If you go on it, I have it on my phone right now, and you can text, chat, or telephone someone who is a professional to link you to services in our state. Hillside also has admission staff on, they're always available 9 to 5, Monday through Friday. These other services that I just mentioned are 24 hours a day, 7 days a week, 365 days a year. But Hillside does have a lot of services. We have a virtual program that we actually love and have started during the pandemic, where we are able to reach kiddos in a very intensive way. The services are Monday through Friday, and you get individual therapy and family therapy and also psychiatric care. We also have an intensive in-home program where we can actually go out to the family's house and provide mental health services at the home, and it includes crisis services. So if you're already struggling with mental health with your child, these are some programs that Hillside can help you with. And if you speak with our admissions staff, they can help you to figure out which one would be best for your kiddo.
That's great, Amy. Thank you. And we're delighted to have you today. I think part of the issue is, mental health has been a conversation topic that people didn't want to talk about, and that was hidden, right? And I think part of having the conversation and talking about it and normalizing it, we talk about physical health all day. Mental health is also incredibly important, and we need to be talking about it. So that's part of why we're here today. Gaan, let's go back to you. So funding for mental health services seems to be part of the problem, and we've talked about the lack of availability in 150 of the 159 counties here in Georgia. Would more funding be beneficial? I'm assuming that answer is yes, but where would that funding come from? Where do you think it can come from, and what can people do to help impact that?
Yeah, of course, funding is one of the biggest barriers. I think when we look at statistic overall, most people who have mental health problems do not seek mental health treatment or do not get mental health treatment. And one of the main reasons that they don't receive mental health treatment is because of cost. They can't afford it. Of course, the first thing is with the parity law, our hope is that, that people will be able to access it using their insurance. That's one of the ways that help us increase access to treatment. And the other piece is, yes, of course, more funding is going to be helpful because there's a lot of needs. And the difficulty is, where does that funding come from? Of course, we look at, the state and the government sometimes to help do these kind of big pushes towards adding more mental health resources or helping build more of the workforce. That's another piece of it, right? Is because there's not a lot of people who are choosing mental health as their profession. And so part of it is kind of building that workforce as well. A lot of the funding, we see nonprofits, we see a lot of philanthropy and programs that are helping to support more funding towards getting mental health treatment. And on the professional level, I know that a lot of my colleagues who may not take insurance or have private practices always set at least some sliding scale or pro bono space. And so I think that's one thing that's helpful for folks to know, that maybe if you can't access mental health, there are lower cost mental health options out there. Most professional will set up a couple of spots in their practice to accommodate pro bono or really low cost treatment. In terms of state and just our resources that's using state funding, the Community Service Board for each of the county provides accessible, mental health treatment where, money is never the issue, so you'll be able to access treatment and see a psychiatrist through the Community Service Board. That's one of the ways in which people can access, mental health treatment as well. And the last piece of it, is that it's always helpful to create awareness so that when you ask, where does the funding come from? Well, the funding comes from people with money, right? And so when we raise that awareness and when we tell people that there is a need, when people are thinking about giving, thinking about their philanthropy, that could be one of the ways that we really encourage people to give towards supporting mental health treatment and mental health care in their communities.
That's great. Thank you. Thank you for that update. And, you know, it sounds like we have a shortage of professionals in many different industries. It sounds like it's the same for your industry. We need to somehow figure out how to get more people into the mental health care industry like you that can help, because we've got a wave of mental health issues, and I don't think we have enough support for it. Amy, we're going to come back to you. So what are some ways to support peers or children who are struggling with their mental health?
The number one word I can say is connection. So we all crave connection, even if we are not struggling with a mental health issue. We're humans, and that's one of the things that sets us apart, is we want connection. So anything parents can do to connect their kid to positive activities in the community. To my kiddo, I've always had her at least involved in one thing that's extracurricular outside of school. If your child is struggling with mental health, I encourage you to have open and frank conversations with your school. We do in Georgia have a growing industry of school counselors and therapists that are actually providing school-based mental health services. So your child is at school most of their week, and so that's a great place to actually engage around your child's struggles. And you have to be very confident, right, that there's not going to be so much stigma, that you are actually getting the help that they will need in a supportive environment. And so just plow ahead and be very bold with talking with your school counselors. And there are social workers in many of the schools as well, depending on the size of the school. So I would say making sure to, if you can find group therapy, that's a great avenue and treatment resource for kids. Kids like to be with kids like themselves. And so if you can find that, if you know, Google is your best friend, you can Google things and find there are many private practices in the metro Atlanta area, especially. Yes, there's a problem with access, and we have a lot of resources right here in Atlanta that are great, that will engage your child around art and different skills. And so your child needs, if they're struggling with mental health, then they need to learn coping skills. And so our treatment here that we use at Hillside is called dialectical behavior therapy, and it's very averse at giving skills so that a child has a toolbox that they're actually using to be able to take that into the community, to be able to stabilize their situation. So they're really practical things that they can use throughout their school day, in different settings. If they struggle in church, wherever they are, they will have the tools to be able to flourish.
So thank you for mentioning that. Can you give us an example of a few of those coping tools?
Sure. TIP is one of our favorite skills here at Hillside. If you ask the kids, that's probably one of the first skills that they will tell you about. And the T stands for temperature. I is intensive exercise or movement, I believe. Progressive relaxation is part of it. And so temperature is a beautiful, beautiful thing. If you are just highly distressed yourself, if you are ruminating in the middle of the night, one of the things that can help is using an ice compact press on your eyes, or being able to splash. It sounds horrible, but it actually really works. So when you're ruminating, if you will splash cold water on your face, it does shift your emotions. There are some neurological reasons that it does that. And so cold water or changing your temperature, take a shower, take a cold shower, will also help. Of course, you can't do that at school. So another thing that we use that's really big is the sensation of sour or hot. So fireballs, being able to shift your emotions by using and focusing on one of your other senses. So because usually when you're in distress, you are having an emotional response. And so if you can take a fireball, which is really hot, this will also shift you away from and distract you. It's a distract skill. Will shift you away from those painful emotions and thoughts that you're experiencing, and get you to be in a different space. So those are a couple of the really quick ones. Gaan and Kimberly can add their favorites. We all have them. So.
Gaan, you want to?
Those are the quick ones in the moment.
Okay.
You know, I really stress those with with our clients. One of my favorites in kind of a more proactive, preventive way is something called check the facts, because our minds and our perceptions of situations are all very individualized, and we all make assumptions very quickly that then impact our emotions. And children and adolescents are the worst, because that's just what they're going through in development. That's what they're supposed to be working on. So you quickly make an assumption that, oh, someone doesn't like me, or someone didn't pick me on their team because I had a shirt on that they didn't like. So checking the facts is training them to kind of check their thoughts as well as check the facts with the other person before they get to a point of being distressed or dysregulated, and then needing that tip skill. And really training them on thinking about their thoughts and their thinking errors at times. One of my absolute favorites.
Yeah, that's a good one.
Yeah, and my favorite is it's pulled from our like emotion regulation skill. It's called ABC Please, and DBT is weird because it has lots of these acronyms. So we're like, why are you talking in weird little acronyms? But the big part of ABC Please is the A is to accumulate positive experiences. You know, oftentimes we go into a stressful situation and our tank's already empty, right? And so in teaching people to go ahead and accumulate positive experiences really helps us stay more stable and less vulnerable to strong, intense emotions. The way I teach it to kiddos, right, is kind of almost like an ATM. You know, if you have a good positive experience, you're putting a little bit of that away in the ATM. And then when you come across a situation where you're really stressed out and it's taking a lot out of you, you're pulling from that. And so for an average person, average day, it's really recommended that we kind of accumulate probably like 7 to 9 positive experiences a day. And this doesn't have to be anything big. You know, it doesn't have to be going to Disneyland. Like waking up and having a really nice cup of coffee is a positive experience. Having a really yummy breakfast is a positive experience. You know, walking the dog and having that moment of peace and just enjoying the neighborhood, right? Like these things that we are doing already throughout the day, that is a positive experience to just slow down a little bit and be mindful of that, and then kind of bank that as like a positive experience. You know, having a really great conversation with your kids on the ride to school is a positive experience. If we're going into the workday with all those kind of positive experiences already, and then you get a call from a client that was just like, oh, that was so stressful, it helps instead of coming in just running completely on an empty tank. And so I really encourage people to really be mindful and accumulate those positive experiences throughout the day. And as a side note, if you already know that you're going into a really kind of stressful situation, one of the things that could be helpful is double that. You know, for most healthy people, we say 7 to 9. So if you're already in a season where you're full of just crisis and stress, then make sure that you have, at least that kind of 14 to 18 positive experiences a day. Make sure to incorporate that into your daily lives. And I think that makes a huge difference and makes us less vulnerable to just these strong stressors and intense emotions.
Thank you. I love all those strategies. And, I think that might be good for all of us. So that might be a good follow-up to everybody on the call, would be some of those tools that we can just remind them of, where they can go back and take a look at those. So my next question ties in with a question that has come in from the audience, and it's effectively about mental health resources. So this individual has emailed in, I'm hearing references to Georgia and Atlanta for resources, which is perfect. It's what we're talking about. But are there any nationwide resources you can provide? They have the 988 number. But are there any other online resources? Is there one or two that you know that are national, and then they do qualify Pennsylvania specifically? So I don't know if you've got an answer for that right now, or if that's a Google search.
I think NAMI is a really great organization, NAMI, NAMI. And it creates a lot, and it's nationwide. You know, it's a nonprofit organization, and most of NAMI's people are families who has a loved one that is struggling with mental health. They offer a lot of support groups in the community, and they generally have a really good connection to the local kind of providers, and they have those relationships established. So I think NAMI in your region is a really good starting point.
That's great, thank you. And while you were talking, I looked that up on my computer, and it is NAMI.org. And it jumps right into mental health and resources there. So thank you for that. There is another message in the Q&A. Somebody just letting us know another resource is poison control is available 24/7 for overdoses in children. So that's just something to keep in mind. And there will be specialists on the phone that will answer that phone. The question is, are providers calling poison control or referring parents to the hotline number of 1-800-222-1222? Do you have any knowledge of how poison control is being used by other professionals?
I know
any experience with that?
I mean, I know here on campus we utilize it immediately as part of our procedure. If ever, you know, a child has tried to hurt themselves while here on campus, we immediately utilize poison control. And parents are educated of it from our perspective in safety plans for when children are at home, of utilizing that phone number. I can't speak directly of other outpatient providers, and if they're utilizing it, I would expect that they would, just because it depends on the type of population that they're working with. But Gaan, you may be able to elaborate a little bit more on that with outpatient providers. Do you know of anything specific that's being used, or?
I feel like 911 is still the go-to for those cases, because a lot of times when people are, if that were to be the case, unfortunately, people are in crisis and they're not going to be thinking poison control. And a lot of times, even though ODing, you know, and the consumption of things that could hurt them is one of the ways, a lot of times there's other ways that people hurt themselves. And so 911 generally is kind of the first call. And if poison control is needed, even then, like 911 can patch them in. So yeah, usually we still recommend that 911 is that first call when it's that crisis, like life or death situation.
Yeah, and I would encourage that 911 usage as well, because you don't want to rely on what they're saying with poison control, because your child or loved one is actually having an outcry. So they're asking for help. When somebody overdoses, they're doing an act, and so that's a pretty dangerous action. And so you need professional help when and you need intervention, not just help, but intervention when that occurs.
It's getting into like some in the weeds a little bit of interventions of how we would approach it at home and so forth. Because poison control can be beneficial, and in certain areas, like if we're trying to avoid hospitalization, maybe. And if it is a cry for help and families have not and they need support, 911 is absolutely. And yeah, 911. And if sometimes you may need to go straight to the hospital yourself. 911 may not be able to come quick enough if you feel like you can safely transport your child.
That's great. Kimberly, let's stick with you. A few final questions. So what are some of the most useful initiatives employers can use to help employees in high stress positions?
I think we've really hit on a lot of them already. One of the biggest things I encourage employers is addressing that stigma. Make the discussion of mental health part of your daily conversations, part of your one-on-one meetings with your employees. Make it a campaign that is always there, not just there because of what has happened currently. Just as you would have an initiative for like how many steps can each team get, or let's monitor your blood pressure, different kind of campaigns that employers do, have the same type of initiatives for mental health. I've seen a lot of really powerful research on the use of mindfulness in the employee setting, and employers leading large initiatives of providing education on mindfulness with their employees, and then providing like breakout rooms to practice mindfulness or meditation, allowing those opportunities in the day-to-day kind of experience at work, or encourage it if you have remote employees, different ways that are constant reminders. The other thing is I would make resources readily available. I would, sometimes I see employers, you have EPA or different things that you can support your employees with. However, they're behind the closed doors of the Human Resources Office, and they are only brought to when we start to see someone struggle. Make everyone aware on a daily basis of this is part of your benefits package. We can help you, so that it's not way at the end that someone starts reaching out. And then I think, finally evaluate your benefits package. Make sure that your benefits package is following that Mental Health Parity Act, and is going to provide as much coverage for mental health services as it would for the physical health services. And, as a tangent off of that, we have seen really, really powerful impact of an employer advocating for their employee's child who is here in treatment at times when, for example, insurance is starting to say, we're not going to cover care anymore. The child has reached their maximum length of stay at that level of care, and or in residential, and it's time for them to discharge. And when the treatment team disagrees and wants that child to receive more treatment in residential, sometimes when the employer is actually getting on and helping their employee in ways to advocate with their insurance company has been very, very powerful.
Thank you, Kimberly. Amy, last question for you. Can we prevent mental health problems?
I wish that you could, but and I'm a strength-based. Part of being a social worker by trade is to be very strength-based. I wish I could say yes. There are, though, so many resources now, and so much on the internet, and so much access to be able to find out how to live healthfully. What Gaan said about accumulating positives is great, great, great advice. Do something. One of my supervisors told me at one point, do something every day where you feel success. And even if that is folding clothes, you have a pile of laundry, you fold the clothes and the pile is gone, and you feel success when that happens. I also cannot understate, my child is like broken record with her. You need to get enough sleep. You need to eat healthy. And with the sleep, going to sleep at the same time every night and waking up at the same time every day, that helps tremendously. It helps with irritability. It helps prevent and just kind of give you all the healthy aspects that you would need to go through your day. Drinking enough water, and it's all like stuff your doctor says, but this also prevents mental health issues from happening. So if you're eating the right foods and fueling your body and training your brain with mindfulness, these are all very, very healthy things you can do to prevent ever needing more services. And then the other thing, I said it earlier in what I talked about, and that is to get early intervention. If you are starting to feel like you are having some issues, go to therapy. Going to therapy 3 to 6 times is useful. So I have a friend right now that needs some help with her son. He started to have panic attacks, and she asked me, how long am I going to have to do this forever? And I'm like, maybe not. Maybe he'll learn some skills. He's about 10, and he won't need to continue to have mental health care. So if you catch it early enough, you can really teach a person how to live their life every day with a lot of health, so that they won't need higher levels of care or have a crisis like we've been talking about.
Thank you, Amy. And I would say my wife would be very happy to learn that you told me I have to fold more clothes at home. So chores,
Yes.
completing chores, even small ones.
Yes.
I'll take it. Gaan, last question for you. So how can a company promote mental health awareness throughout the year? We've touched on this a little bit, maybe some final comments on it.
Yeah, I think Kimberly covered a lot of that, and you know, creating opportunities for conversation is helpful. You know, we talked about normalizing mental health being a big piece of it, and the ways in which you can normalize and help reduce stigma is having conversations about it. And most people don't just like talk about mental health, right? And so when you're having planned activities where it brings awareness, is always going to be helpful. One of the ways that maybe not just promoting mental health awareness, but also supporting mental health, like mental wellness within the company itself, you know, so those initiatives that Kimberly talked about, you know, I think a while back at Hillside, we had a meditation challenge, you know, where we had 28 days of meditation and people were able to do it at whenever they wanted to, but they can join in, kind of like, you know, how companies do like steps and different departments kind of win. So those are some easy, fun ways to do that. And the other ways that companies can really help promote mental wellness is also looking at how feedback is given with employees. You know, is there ways in which we can help reduce the stress level? We've seen a lot of information and data on, you know, flexibility in schedule sometimes really reduces a lot of stress, especially for folks who are juggling, you know, family life and work life, and having a little bit more flexibility in their schedule while still able to complete their task reduces that stress immensely. And so there are different ways that you can look at your employees and say, what would be helpful, you know, in order to just reduce general stress in your life so that you can become even more productive and healthy.
That's great. Thank you. And I want to thank each of you for taking the time today to talk about mental health, especially with our youth. Incredibly important conversation. And like we've all talked about, it's about communication and not making it a stigma, and finding tools and opportunities to let people be able to relax and to address their mental health issues. So Kimberly, Gaan, and Amy, thank you so much. I want to thank Hillside again for giving us the opportunity to partner with you on this important topic. So our time is up for today. I want to thank everybody who joined us. And hopefully we've been able to clarify a little bit about the state of child mental health, to provide some tools and maybe give you some tools to recognize somebody who might be in crisis or having an issue, and finding ways to address those. Again, I'm Dave Mathews with Sterling Seacrest Pritchard. Thank you so much for joining us today. Look forward to seeing you in the future. Bye-bye now.